If you manage a hospital, physician group, or other healthcare provider, or work with a health plan or healthcare clearinghouse, you already know that the Health Information Portability and Accountability Act of 1996, or HIPAA, established national standards for the privacy and security of an individual's protected health information for covered entities such as yours. You're probably used to dealing with these on a daily basis, from seeing your written notice of privacy practices being distributed to patients, to monitoring the administrative, technical, and physical policies and safeguards that your particular provider has adopted to protect and secure electronic patient information. But when HIPAA makes the nightly news, it isn't to report that the U.S. Department of Health and Human Services and its Office of Civil Rights, which enforces HIPAA, has adopted some new and exciting data security technology. And it isn't to talk about the latest regulatory wording for provider notices. No, what gets everyone's attention where HIPAA is concerned is when something goes wrong. Maybe a laptop is stolen from an employee's car. Maybe a company forgot to wipe the hard drive from their copier before returning it to the leasing company. Maybe there was a systems glitch and patient information became available through a Google search. Or maybe a curious and indiscreet employee accesses medical records for reasons completely unrelated to providing treatment to the patient. These are all true cases. Not surprisingly, the #1 HIPAA issue investigated by the Office of Civil Rights is the impermissible use or disclosure of protected health information, a breach of the privacy and security of the information. Regardless of the circumstances, whether large or small, intentional or accidental, an impermissible use or disclosure under the HIPAA privacy rule cannot simply be ignored. A provider has an affirmative duty to assess every situation where the privacy of information may have been compromised. Depending on the assessment, the provider may be required by HIPAA to report the situation to patients, the Secretary of Health and Human Services, and perhaps even to the media. In this presentation, we'll provide you with an overview of what is required in the event of an impermissible disclosure and the requirements of the HIPAA breach notification regulations.